So here's an example of a patient that probably has been in pain for many years. Migraines, clicking, popping, jaw issues, had a lot of neck issues, was constantly seeing a chiropractor. Once she went into an orthotic and we established her vertical height, all her symptoms went away. So then the challenge was, how do we take that stable bite in the orthotic and transfer it to the final restorations? Yeah, so treating pain patients is a little challenging sometimes because we want to stay conservative and not over-prep the teeth, but at the same time, in order to get them out of pain, and if they choose to go the restorative route, we do have to involve the teeth in some way. Pain patients that require their vertical to be increased in order to get out of pain, people who are overclosed or retruded, a lot of the times, once you establish the vertical height, the challenge is to convey that to the lab and also maintain that vertical step by step. So from going from the orthotic to the temporaries and then again to the finals. So this is a patient that was in chronic pain for many years, adjusting her bite to a new vertical. The challenge was how to rebuild her bite and transfer that to the lab, and I decided to do this on the Roland dental mill. And so we started off with the 3-7 from the orthotic and cut the 3-7 on the mill, wanted it in. Once the vertical was stabilized, moved on to doing the 3-6 and 3-5, stabilizing her left side, and then moving on to the right, and same thing, 4-7, cut on the Roland mill, and then cut the 6 and the 5. And essentially everything was done one day, managed the bite, and of course T-scan at the end. I was able to essentially really hold her bite in the exact position that I started out with simply by measuring, designing, sending it to the mill and having it cut precisely to where I wanted it to be. So we really tried to stay conservative and maintain pretty much all tooth structure and also allow her to finally be pain-free, probably for the first time in over 20 years.